This video provides information from the internet, and we do not promote any products or medicines. Always consult a doctor before using any medication. We are not responsible for any side effects or issues resulting from self-medication.
Citistar PM Tablet is a medication that combines citicoline and piracetam. It is used primarily for managing acute strokes and cognitive issues. Indications and uses. This medication is indicated for the management of acute stroke and memory loss associated with age-related cognitive decline or brain injury. It works as an adjunctive therapy to enhance recovery and cognitive function. How it works. The combination of citicoline and piracetam in the medication enhances blood flow and oxygen supply to the brain while protecting nerve cells from further damage. Directions for use. Take this medication as prescribed by your physician. It should be swallowed whole with a glass of water and not crushed or chewed. The dosage and duration of treatment will depend on individual factors such as age, weight, and specific health conditions. It's important not to discontinue the medication without consulting a healthcare provider. Possible side effects. Common side effects may include headaches, dizziness, constipation, and weight gain. If any of these effects are bothersome, consult with a healthcare professional. Precautions and warnings. Before using this medication, it's essential to inform your healthcare provider if you have any history of liver or kidney problems, bleeding disorders, or depression. Pregnant or breastfeeding women should only use it if deemed necessary by a physician. FAQs. 1. What are the uses of this medication? It is used for managing acute strokes and cognitive issues. 2. How does it work? It improves blood flow and protects nerve cells. 3. What should I do if I miss a dose? Take it as soon as you remember, but skip it if it's near the next dose. 4. Can I drink alcohol while taking this medication? It is advisable to avoid alcohol for optimal results. Thank you for watching. If you have any questions or suggestions, please feel free to leave a comment below.